Hey there, it's Angel Face Amy, your ostomy nurse friend, back with another helpful video. Today, we're going to troubleshoot some of the most common ostomy problems that I see with my patients. If your pouch leaks, your bag won't stick, or you're dealing with itching or other weird pouch issues, this one's for you. Let's break it down so you can feel more confident and comfortable every single day. First, we're going to start with watery output. This is a big one. It can cause leaks and skin irritation because liquidy, watery output is more likely to escape your pouch. Sometimes watery output happens because of what you eat, drink, or medications, or even infections. Try keeping a food and drink diary to track what might be causing it. Staying hydrated is very important, but certain drinks like caffeine or alcohol can also loosen the stool. If the watery output lasts more than a few days or you notice signs of dehydration, contact your healthcare provider. Sometimes your provider might recommend medications to help thicken your output. Always check with them before trying anything new. So next, if your pouch isn't sticking well, it's usually because the skin is oily, wet, or there might be lotion residue. Make sure to clean your skin with just water, and make sure you let it dry completely before applying your next appliance. Cut your wafer carefully. Too big and it leaks, too small and it can irritate the stoma. You can also use barrier rings or paste to fill uneven skin areas and improve the seal. If you're struggling despite these tips, talk to your nurse about trying different products that might work better for your skin type. There are all kinds of different products, different adhesives, gentler ones that are meant for sensitive skin, and then just different products use different things too, like Coloplast versus Hollister. They all have a different makeup of their adhesive, and some might just work better than others for everybody's skin. The next problem we're going to talk about is pancaking. This is when stool collects around the stoma opening inside the pouch, and instead of falling down to the bottom of the bag, it sits all up at the top and it gets underneath the barrier, and this causes leaks and odors. To help, try switching to a vented pouch. Also, I've noticed is that sometimes the major problem is that the pouch kind of just like sucks down on itself, and it kind of holds the stool up at the top. So if you kind of put a little crumbled piece of toilet paper or just get a little air inside the bag, that helps to let the stool be able to fall down in the bottom and not get just trapped up at the top. You also might need to try adjusting your diet to reduce gas and output consistency. The next problem is ballooning. This happens when gas builds up and inflates the pouch. Using charcoal filters or vented pouches helps release the gas effectively and so that nobody can smell it. If gas is a frequent problem, pay attention to the foods that you eat that could cause gas and try limiting those foods. Both issues can feel frustrating, but they can usually be managed with some adjustments. So hopefully just, learning about these tips and tricks or maybe talking to your ostomy nurse can help you get you in the right direction so you don't have these problems. Sometimes your skin might itch. So this is the next problem. We're going to talk about itchy skin. So even when you don't see a rash, it can itch. This can be from dryness or sensitivity to adhesives. Using gentle moisturizers around but not under the wafer can help soothe the skin around the barrier. You could also try, adhesive remover wipes to take off your pouch more gently if the itching continues. Again, make sure that you wash all the adhesive remover off, though, because this will really hinder the next appliance adhering well to your skin. You could also see your nurse for other product options or even a skin evaluation. Troubleshooting your ostomy can feel overwhelming, but small changes often make a big difference. Remember, your ostomy nurse or healthcare team is here to help. Thanks for watching. Like, subscribe, and drop your questions in the comments. I love hearing from you.